Who's Jax? Okay.
The other computer.
Okay. I thought it was one of your little animals.
No.
Gotta get this right here.
This is Jax.
This is Ringo.
Ringo. Hi, Ringo. What a cutie. So cute.
He's a handful, but he's about 18 months old. 19, right?
Or yeah.
Yeah, he's still a terror.
Is he a mix?
Oh yeah, he's a whole lot of mutt. Mostly Chihuahua.
Okay. He's pretty big for Chihuahua.
Yeah, he's about 24 pounds.
Yeah.
Yeah, but about a third Chihuahua and then like pretty much everything else. Yeah, a lot of big dogs.
Hey, Carrie. You're muted.
You're muted.
There we go.
Yes.
I don't understand why this is such a novelty, even though it's not. Hey, Paula, nice work. Nice nursing work there.
Oh, it's what I do.
Hi, Carrie.
Hey, Aday, how are you?
Good, thanks.
Hey, Rick,
Hi, Carrie.
how are you?
Good.
Jackie.
Hey, Jackie.
Jackie and Jackie.
And Emmy. I haven't seen Emmy in years, it seems.
Hey.
So Kevin is going to be 5 to 10 minutes late.
Okay, so we should get started then. So I'll call the meeting to order. We're going to review the minutes and from the last meeting, hopefully approve them. We have a couple tobacco related issues that Maureen Busby has joined us to discuss with today. We have a variance request on a septic system, a couple updates on variances that we've approved in the past. Kevin may or may not have an update from the coalition, and then usual monthly report, public comment, and so forth. So pretty compact agenda. Are there any other items that we should add to the agenda? No.
Not that I can think of.
Okay. So in terms of the minutes from August 4th, they look, once again, Jackie, pretty good
Perfection.
to me.
Perfection.
The one thing that was actually, I think Kevin did say that this recovery and remembrance event was September 28th. I believe he said that, but in fact, obviously it was 2 weeks ago, August 28th.
Oh, no.
But I think the minutes are accurate because I believe he said that.
There is another event on the 28th.
Oh, there was another.
Ah.
Another one, yep.
Oh, okay. Oh, good. Well, then it's perfectly accurate. So I'd make a motion to approve the minutes from August 4th. Do I have a second?
Second.
Carrie, second. Roll call. Paula?
Yes.
Carrie?
Yes.
Rick? Yes. Great. I think that Aday wanted to introduce the newest member of the team, and then we'll get right on to the tobacco issues. Aday?
All right. Thank you, Dr. Lopez. Good evening, members of the board. Please join me in welcoming Mallory McDonald to our health department. Mallory is the new public health nurse. She joined our team on August 22nd, and she is a registered nurse with vast experience in kidney dialysis and home care. Mallory?
Hi, everyone. My name is
Welcome.
Mallory, obviously. I've been a nurse for 6 years. I do have a strong background in kidney dialysis as well as home dialysis, as well as just home care. I've done that as well. And my previous role was a case manager, but I'm really happy to be here and join the team.
We're really glad that you're here. Looking
Welcome.
forward to working with you.
Welcome.
So actually, Mallory, just so maybe we could just introduce some of the board members. I'm Rick Lopez. I'm the chair, retired primary care physician. And Paula, do you want to comment?
Sure. Paula Curran, retired pediatric nurse practitioner, former public health nurse in the town of Reading 100 years ago. About.
Carrie?
And I'm Carrie Donnell. I am, let's see, I work in public health. I've worked in public health for about 20 years and primarily focused on public health emergency preparedness. So yeah, I love this work. So I'm really glad you're here. Welcome.
Jerry?
Yeah. Hi, Mallory. Welcome. Great to have you. I'm also a nurse, although I work right now for a medical device company, but I'm probably the newest member of this board. So I'm still learning a lot from everybody, but we're so happy to have you. So welcome.
Great. All right.
And Kevin will probably introduce himself later.
Yes. So Aday, do you want to?
All right. So I will now hand it over to Maureen Busby to give us information about updating our regulations to match the new state law. She will also provide information about rejoining the Regional Tobacco Collaborative. Maureen?
Okay, Aday, thank you, and thank you to board members and others who are here tonight for allowing me this time. What I'm going to do is I'm going to quickly review some of the important elements of the new state law that was passed in late 2019, because now what we have is a situation where our municipalities' local Board of Health regs are out of sync with state law. State law trumps, so we are enforcing state law, but it's easier for education purposes and compliance by the retailers if local regs match up to state law wherever possible. So that's the purpose of the first part of this. And then after I've finished about the regulations, I'll explain to you the recent happenings at the state that will allow us to offer Reading the opportunity to rejoin the Tobacco Collaborative. So the state law was very comprehensive. What I'm going to touch on tonight are the pieces that apply to tobacco sales, retail tobacco sales. There were other parts of the law that related to cessation insurance benefits, the state's tobacco program budget, and other important areas. But again, we'll focus on the sales regs. A lot of the changes that we'll propose to you, I won't go over in detail tonight because they're really definitional changes or wording changes. But I do want to talk about the ones that I'm recommending that you consider and vote on. So back to the law, an act to modernize tobacco control was passed by the state legislature and signed into law in late 2019. Some of the provisions in that law were effective January 1, 20, and some were effective June 1, 20. I'll be covering a lot. Don't feel you have to take copious notes. I can give Aday my notes and he can pass those on to you if that's helpful. So the big one that everybody usually knows about is the flavor ban. The law included a flavored vape product ban that was effective January 1. That's one of the differences. The vape product flavor ban was effective 1/1/20, and the flavored tobacco products like cigarettes, cigars, chewing tobacco, that was effective 6/1/20. So for vapes, no flavored vapes of any kind, not nicotine, CBD, or any other substance through a vape device, with two exceptions. Licensed facilities such as medical marijuana dispensaries and recreational pot shops can sell flavored vape products. Currently, Reading doesn't have a recreational pot shop or medical marijuana dispensary. And the other exception is adult-only smoking bars like a cigar bar or hookah bar can sell flavored tobacco products, combustible tobacco products, for on-premises use only. And again, Reading doesn't currently have any smoking bars. So again, flavored vapes, banned 1/1/20, and flavored smoking tobacco kinds of products, 6/1/20. I did do education of your retailers in Reading back when this new law came out. And since the new law, I've also done inspections in Reading and compliance checks. And I'm happy to say that Reading retailers were very, very compliant with the new law. Fines were increased from $100, $200, $300 to $1,000, $2,000, $5,000. Since your local regs show and include the $100, $200, $300 fine structure, this is an area that I recommend updating. Again, state law will trump local regs, so if there is a violation, we'll be applying the $1,000, $2,000, $5,000 fine, but your regulations have the older language in it. We have something called the tolling period, which is, it's like a probation period. Once a store has a violation, we look back 3 years, 36 months. Reading already had 36 months in their regulations, but the state adopted that statewide, effective with this new law. So we sometimes call this a look back period. If there's a violation, we look back 3 years to determine if this is a first violation in that 3-year period, a second violation, or a third violation. And that determines the fine amount. So it's either going to be $1,000 for a first violation, $2,000 for a second violation, or $5,000 for a third violation. And it also determines the length of the suspension. And there's no suspension for a first violation unless it is a sale to a minor. And that's new in this state law. Prior to this, none of us had a suspension for a first violation. And your local regs do not show one currently. But under the new law, if it's a sale to a minor violation, there is a suspension that has to be applied. And to make it a little more complex or confusing, again, it's only with that kind of violation, not if the first violation is sale of a flavored product or some other violation. And there isn't a set number of days in the new law. It's 1 to 30 days. The law says 1 to 30 days to be determined by the Board of Health. So that means if there's a violation, you have to meet and determine, is it 1, 2, 5, 6, 16, whatever days. Whereas if it's a second violation, it's set, it's 7 days. If it's a third violation, it's set, it's 30 days. And your local regs match state regs on that. So what we're recommending to our local communities is that the Board of Health decide on a set number of days, and I would recommend something less than 7. A second violation is more serious than a first, and that has 7 days, so maybe a number of days less than 7 for that first violation. And then that number of days, 3 days, 5 days, whatever, would be applied in every situation, and you wouldn't be deciding that and questioning, gee, what did we do last time or whatever. It would be consistent. And also the information relayed to the retailer at the time of sale would be available. We'd know the fine because we'd know if it was a first, second, or third violation, and we'd know the number of days. So anyway, that's one of the considerations I recommend that you think about and vote on, not necessarily tonight, but this first meeting is to explain all this. Then I suspect you'll probably want a draft of a revised reg. We can provide that for you, and then you'll look at that and then probably vote at a next meeting. A few other things: state excise taxes were imposed on all e-cigarettes products for the first time, which means the Department of Revenue has to license e-cigarettes for the first time. So now a retailer might need 3 licenses depending on the products he sells. One for cigarettes, one for cigars and other smoking tobacco, and one for e-cigarettes. And that's something that we check when we go in to do an inspection. Also, there's a lot of new signage required in the state law. So in addition to other signs that are already required and the new ones, a store might need up to 9 different signs depending on the type of store and the types of products they sell. All customers must be ID'd now for tobacco sales. Formerly, retailers were required to ID all customers who looked like they were under the age of 27. Now they must ID all customers of tobacco products. Now, a 30-day violation, and your regs match the new state law. But we do want to tighten up that language around the first sale to minor violation having a suspension. And then I also want to distinguish between state law violation fine amounts and local reg fine amounts. Once you line up those provisions that are in the state law and the fines match, there's still another little area that we need to be that we need to consider, and that is you have some local tobacco regs that are not part of the state law. You have a minimum cigar price, you have a blunt wrap ban, I can't remember, there might be a couple of others. And those regulations, since they're not covered in state law, would have the $100, $200, $300 fine structure currently in place, unless you decided to increase the fines for those local regs and have the same fine structure for all violations. And I'm not recommending one way or another. I'm just giving you that opportunity to line up all your fines so you have one fine structure. It applies to state law violations and applies to Board of Health regulations, or keep it the way it is and just recognize that you're going to have a set of fines that apply to the violations that are under state law and a different set of fines that are with those other local regulations like the blunt wrap ban or the cigar minimum price. So I know it's a little complex, but as I said, the state law was comprehensive and it's a great state law leader in the nation, but it does bring with it some complexities. Now, there are a few other things. A manufacturer's letter is required for all products attesting to the fact that they don't have flavored ingredients. The manufacturer's letter is required for all vape products, indicating the nicotine content, because family-friendly stores can't sell a vape product that has greater than 35 milligrams per milliliter nicotine. And these are all things that we check when we do inspections. Underage buyers cannot be fined. The law made it clear that the penalty for a sale to a minor is assessed to the seller, not the purchaser. And unlike alcohol, it is not illegal for a minor to possess a tobacco product. Also, a store can't advertise any products they can't sell. So no more, Newport menthol ad signs in the window. Other older provisions of state and local law still apply. Local Board of Health is required. No sales in pharmacies or educational institutions. No coupon redemption. No out-of-pocket sales. Humidors and other self-service displays must be locked or out of reach of the customer. Liquid nicotine containers must be child safe. Cigar minimum price, blunt wrap, permit cap, proximity ban, and ETS regs, environmental tobacco smoke regs, still apply. Obviously, retailer education has been critical. The goal is compliance, not to penalize the retailer. We want to let them know what the law is and what they have to do to comply. In the case of a violation, a store owner has the right to an appeal. Appeals are made to the local Board of Health. Board members will hear testimony from the retailer and from the enforcing agent and decide if, in fact, a sale took place and that proper protocols were followed. Because the new fines exceed the so-called 21D ticket or silver fine limit of $300, if a retailer wishes to appeal the fine amount, not the fact that a sale took place, but the fine amount, then they need to file an appeal in state court. To wrap up, again, those two major considerations: do you want to update your local regs to line up with state law? And if you do you want MTCP to prepare a draft reg for you? And when that happens, you also want to decide on effective date for the new regulations. or I should say updated they're updated. It's not necessary to hold a public hearing on these kinds of updates because it's not a brand new provision. If you were doing a brand new provision that wasn't part of your regulations already, then you would probably want to hold a public hearing and allow the public to come in and you know, have a say. So in summary, if we did this, you know, if you did this, we'd be providing you with the updated language that's mostly definitional. Decide on set number of days for a first violation, if it's a sale to a minor. Decide if you want to change all the fines to match state law. So change everything to 1,000, 2,000, 5,000, or leave your local regs at the $100, $200, $300 level. And do you want to increase cigar minimum price for inflation? As our communities, our local communities have been adopting these new regs, another thing that we've asked them to consider is the minimum cigar price regulation was put in about 8 years ago. And the minimum cigar price is $2.50 for any single cigar and $5 for any multi-pack. And so Boston Board of Health Boston Health Commission did a calculation, and because of inflation, determined through, you know, PSI and whatever they used, index they used, that they changed their minimum price for a single cigar to $2.90, and multi-pack changed from $5 to $5.80. So other local communities have increased the minimum cigar price. So that's something that you may consider as well. So I know that's a lot, and you might, if you want me to stop here and have a discussion before we talk about the opportunity to rejoin the formal funded collaborative, I'll do it whichever way you want.
Yeah, I think it would be useful for us to have a discussion about what you just talked about, and then kind of go on to the other topic.
Okay.
And so thank you for spending some time with us tonight. I guess I'll start out. I have a couple questions. One is, what are most communities doing in terms of suspension of sales for the first violation? You said that it would generally be 6 or less days. What are most communities going?
So, yeah, good question. I should have mentioned that. So the most common numbers that I've heard, and I don't know why, but these are the many have selected 3 days. And 2 of your local communities that I work in, Wakefield and Melrose, selected 5 days. But I have heard of a community with 1. Not crazy about 1 because it doesn't seem that significant. One day you barely go in and out, and I wouldn't even have time to check to see if they took tobacco products off the shelf. You know, it kind of hardly seems worth the trouble to do a 1. But that's my opinion, not any more than that. And also, I should have mentioned, in terms of effective date, as you think about this, most of the communities have given, you know, we'll call it notice, like 2 months notice. And so if you were to decide, say in this meeting, which, you know, I'm not recommending that, but say if you were to decide, and today is September,
8th.
whatever it is, 8, then you wouldn't want an October 1 date, and maybe not even a November 1 date, but maybe a December 1 date. So we have at least 2 full months. One, the day would send out a notice to all the retailers that the new or revised regulations have been adopted. And then one of us, and I'd be happy to do this, but we'd visit with each retailer with a hard copy package of information about the new regulation. And you can always send out the whole regulation, but what I recommend is kind of a tip sheet for the retailer, highlighting in just bullet points what the changes are, because my experience with a lot of retailers is they don't read a whole package. We want to make it something that they know what the information is, but they can absorb it and get to compliance right away.
And my second question, then I'll ask other board members, is this whole thing about minimum sale amount, you know, $2.50 or $5 or whatever it is. What is the rationale behind that? It doesn't, it seemed to me when I was reading the regs, it seemed kind of odd.
You know, I have to say, I kind of agree with you, because since that regulation was adopted, We've had so many changes in the industry in terms of what products are offered. But back then, when we came up with this strategy to try to reduce youth access to tobacco products, what the youth were using at the time, what they were migrating to wasn't cigarettes. We already had high prices on cigarettes, so that helps with accessibility for youth, for anybody, and that's the goal. But they were buying pink and purple flavored cigarillos, 79 cents, 69 cents. Those are the wrappers we saw around school playgrounds and parking lots, and that's what we knew youth were using. So some calculations were done by some institute, not me, about what was kind of the impulse purchase breaking point for youth entering a store. So they go into a store after school, they buy their chips or their soda, whatever it is. What price would possibly prevent them from picking up those 79-cent grape flavored cigars? And it was determined that $2.50 was the price point for singles, $5 for a multi-pack. So we did that, and it was amazingly successful because, not quite overnight, but pretty soon, those 69-cent, 79-cent strawberry, green apple, whatever cigars disappeared from store shelves. A couple years later, vape products came in. And that changed the scene. So I totally get your question, and I agree with you. It seems odd now. It seems a little odd now.
How much does a vape product cost?
So it depends. If you remember the jewel pods, a 4-pack was generally four pods, $15, $20. But it's really all over the place depending on the profit that the retailer wants to make. And then a vape pen was like $20. The jewel device was $25, $30. And amazingly, kids had the disposable income and they were getting them.
Okay. So listening to that, two things strike me. One is that we have a vape problem in the schools and not a cigarella problem. And
yeah.
And $20 is fine to buy the vape, and we're like micromanaging the cigars.
Yeah.
And then secondly, obviously, not technically, legally, the retailer is not supposed to sell anyway to someone under 21.
Right, right, exactly, yeah.
That's overriding. So it's just certainly a thing to think about.
Yeah.
Other questions or comments by board members?
A question about chewing tobacco. Is that still as much of an issue? Does that need to be addressed as well?
So there's something new on the market, Nicotine Pouches. It's a non-tobacco product. So it's not regulated in the same way that, fortunately, under the state law, which is very broad, very comprehensive, and very forward-thinking, we can and we do regulate nicotine pouches. The DOR doesn't regulate them in the way that we do under our tobacco law. So nicotine pouch, it comes in a tin that looks like a chewing tobacco tin. It's very cheap, so much cheaper than chewing tobacco. There's a brand called Zyn that you can get. I think you get 15 pouches for $4.49 or $4.99. And there's another one called On, O-N, exclamation point, and similar price for generally, but they have specials all the time that you can get 5 tins for $5, and there are 15 or 20 pouches in a tin. That means you can get 15 or 20 pouches for $1. But the stores, the promotion doesn't allow you to buy a single tin. You have to buy all 5. So you get 5 for $5, makes the unit price $1. But it's a very interesting strategy because if anybody has that many tobacco pouches nearby, whatever, they're going to use them. And of course, we know the more nicotine you use, the more apt you are to be addicted. So there are actually some newer products that we're very concerned about. We can apply the flavor ban and obviously sale to minor and all those others. What we don't have any control over is those low price points, and we are concerned about those. And we come back at some future time with a strategy around that. But not tonight.
Right?
Enough for tonight. Yeah, that would be one of those new you'd do a public hearing, you do the whole thing. We're just looking at updating what we have.
Carrie?
Thanks, Rick. And hi, Maureen. It's nice to see you again. I remember you walking through with us in December when we had a violation and we had to determine the term of the suspension. It was a first offense, and you gave a great and thorough talking through for us then, and you've done the same tonight. So thank you. I had two questions because there are a few different things that we've got to consider here. Could you tell me again, what are the things that we have local regs for that we don't, that are not covered by the state regs?
You have a blunt wrap ban, so Reading doesn't allow the sale of blunt wraps. That's a wrap where you would put in your weed or whatever. So you could put tobacco in it, but we banned that back actually in the days before marijuana was legal, and we knew that people were buying blunt wraps to smoke their weed. So that's one of those older regs. Let's see, what else do you? Oh, the cigar. So I think the main ones are cigar minimum price and blunt wrap ban. And then older, let's see, you can't vape or you can't smoke, but that's an ETS reg. No out of package sales, yeah. I think those are the two.
Okay, thank you.
Everything else would fall under a state law.
Got it. And then, and maybe I missed it. How many retailers do we have in Reading?
Oh, I could have looked at it. I think you have 16 or 17.
Thanks.
Interestingly, in the regs that a day sent out, there was it looked like there was a ceiling of 19, and that,
right,
you know, as retailers go out of business, their licenses are not renewed or taken off. So it was actually an intent to reduce the amount of retailers over time.
You know, that brings up a good point, which I didn't even look at for purposes of tonight, because I was focused on the state law, which doesn't cover the permit cap. By the way, permit cap is a local reg, but it would be handled differently from these the tobacco sales regs. So if you have a cap, I know that, and you have a proximity ban. I remember yours was unusual in that you did 1,000 feet instead of 500 feet. Most people have a proximity ban that says no new tobacco stores within 500 feet of a school. And yours is 1,000, so a little more restrictive. Good for you. But if your permit cap is 19 and you have 16 stores, then one of the other things you could do to make sure that new stores don't come in and capture those remaining available permits is you can change the number. You can vote to change that cap, in the permit cap provision. So you could make it 15. You might want to go down. Might want tobacco store density to go down. So if you have 16 now, you might say, let's make it 15, and then the next store that leaves, that permit gets retired.
Mm-hmm.
And some communities have done that, but I didn't focus on that tonight, again, because I was focused on lining up your regs with the state regs.
Right. Okay. Thank you.
Any other questions? Okay, so what I'm hearing is there's potentially about 5 different items that we should sort of agree to, and then ask Day and Maureen to go off and come back to us at the next meeting with those revisions. And so and so they are the fines, this whole issue about setting cigar prices, the issue about the suspension time on the first violation, whether we want to cap retailers below the current cap, which is 16, and that issue around the wraps, which I don't think is as critical. So why don't we just take these one at a time and kind of go through them. Paula?
Just was the consideration of the time of a suspension a sale up to minors, a separate entity? That was my
No.
understanding. Is that
No,
a separate?
that was one of the items I had mentioned.
Oh, I thought it was a general one. Okay.
Oh, maybe I didn't make it clear. So actually, why don't we start with that? So as I understand it, currently for the second violation within 36 months, the suspension's 7 days of not selling tobacco products.
Mhm.
And for the third violation, it's 30 days.
30 days, yeah.
Right. And so what is being proposed is for us to come up with a number less than 7, because the first violation shouldn't be more severe than the second. And that is more fixed, so that unlike, last December, we really don't have to decide, it just would automatically happen.
Mhm.
And the question is, sounds like there's one community that had 1 day, most communities split the difference at 3 days, and some have 5.
Correct.
And so, I would be fine with, I don't have a strong feeling here. I think 5 is a little hefty for the first violation, but 1 or 3 I could live with. How do other people feel around that?
I'd like to have at least 3.
Great,
Agree,
great. Others?
agree.
Very
Yes,
Yeah,
good.
three sounds good.
okay.
At
There
least-
should be some severity to it.
Yes.
Yeah. So that's one point. And then in terms of the fines, I think going up to the state is sort of makes sense. The $1, $2, and $5,000 fines.
Mhm.
Agree.
Everybody agrees on that.
Yep.
In terms of section 16.5, which is the minimum cigar price, I feel like it's a little bit antiquated, and maybe we should just delete that section altogether. Unless Paula doesn't.
Yeah,
As soon as we do it, it's going to tick up.
agree.
But don't you think that if kids are buying, first of all, they shouldn't be sold this, but if they're buying vape pens at $20 or $15, isn't a $2.50 or a $5? I mean, if the original rationale was to make it out of their purchase range, it seems like it's outgrown that. But that, we could leave it in. Carrie, what do you?
Well, I'd suggest that they're different markets, and that, the younger kids who maybe are experimenting earlier, maybe don't have access to 2025 or aren't interested in trying vape. But so the cigars are kind of a opportunity for a gateway, an entry level. And so I see them as maybe a little bit different. I don't know if that's accurate. I don't know if the vaping descends down into the middle school, the 10, 11, 12s, as much, but that's my sense. So in that instance, I'm with Paula. I mean, a vape is kind of a commitment, whereas, oh, I'm going to try it, I'm going to try a single cigar, that's different. That's how I look at it.
And it can become a trend again. That's what concerns me.
Okay.
Instead
Yes.
of deleting it, can we actually increase it?
Yeah, that's where I'm going. My thinking is, I agree. I think.
Okay. So maybe it's interesting that the Boston Health Department was so precise at $2.98. What we want to increase it to, if we'll keep it, to 3, and I think they said 550 or 570, whatever.
80.
580.
3 and 6.
3 and 6.
Yeah.
3
I'm
and
sure
6.
I'm sure they used a formula, and that was why. And so then it's because it's easily defensible, because they have a lot more retailers to.
No, that's true.
with.
Yep.
So, but yeah, no, I agree. 3 and 6.
Sounds good.
And then around capping the retailers, the way I read the regs was that when they were published in 2017, there was 19 retailers, and since then now it's down to 16. The regs actually don't have a minimum or a maximum amount. So as I read them, so that as the numbers, as retailers go out of business or leave or move, and that permit goes away, the number could potentially go down to 0, as I read it.
I don't see a problem with that.
No.
Rick, you could be right. This is a provision that is different in almost every community I work in. They just chose a slightly different way to do it. So I can certainly ask our TAs to take another look at the way yours is written and just make sure that we're interpreting it. But I didn't bring the regulations with me. Sorry about that. But I suspect you are exactly right. And maybe yours just drop off when a retailer doesn't renew. Instead of, in most communities, I shouldn't say most, in many communities, there's a grace period. It says if no new retailer comes in and applies for that permit, a permit at that address, then that permit will become permanently retired. And the idea behind that was we felt it was an important strategy, but we were trying to protect the value of the building. So if a landlord had a store in his building and that store sold lottery and tobacco products, then we didn't want to remove that if that storefront became vacant because the owner retired or whatever it was, the store owner retired or whatever it was. That storefront would have more value to the owner of the building if they could sell cigarettes and unfortunately, if they could sell lottery tickets and tobacco. So that's why most communities chose that way of writing it. But yours you did a couple things differently, and you might have done it the more restricted, better way.
So why don't you look at that? But I think my reading under that 16.6 paragraph 10, and the last sentence says sales permits shall be reduced by the number of the retired permits. So it seems like it seems
clear. But I made a note to myself to make sure that when our TAs do a draft of new regs for you or revised regs, updated regs for you, that we're clear about that.
Okay. And then the last thing which had come up was around the sale of wraps, which is different than
Rolling papers.
rolling papers.
Yeah, there are rolling papers and there are blunt wraps, right?
Yeah. but yeah, just blunt wrap. Yeah.
Yeah. So we currently don't allow that, and that's different than in the state regs or what you're seeing elsewhere. Is that right?
Yeah. So many tobacco control advocates believe that we should keep the blunt wrap ban in, even though marijuana is legal now. It's not legal, obviously, for young people. But the reason is because blunt wraps are made out of tobacco, and tobacco has nicotine, tobacco leaf has nicotine in it.
Got it.
So there's still the opportunity to get addicted to tobacco, even if you're rolling your weed in that blunt wrap.
Okay. So we probably want to just leave that. Because
A great question. Really good discussion. I'm glad you're bringing up all these questions.
Carrie, yeah.
So I agree with all that. I have a question then, because that's under the local regs, and
Right.
the local reg fine structure is different than the state reg fine structure, and our local reg fine structure is still at the 100, 200, 500.
Right.
Do we keep?
And so the question is for, and Maureen had raised this, for the cigar price violation and maybe for the
Right, for both. Yep.
for these wrappers, maybe we maintain the 100 200, 300 fine, because it seems pretty, I don't know, maybe it's pretty harsh to do $1,000 for those, but I
Right.
could be wrong. I mean,
It
What do you think?
seems less likely to be an issue.
Yeah.
On those two items.
Yeah.
I'm,
Yeah.
I can't recall anybody needing a fine
Right.
in recent history.
Right. Mostly, you know, I don't know if I really want to say this out loud, but mostly, you know, when we're doing checks for minors, I seldom have them ask for blunt wraps or even a flavored cigar. What I'm generally having the underage trained youth buyer ask for is either cigarettes, because we have to do that as part of our federal funding, and then whatever the current hot item is. So it was Jewel Pods for a few years. You know, now I'll do a round having them ask for the nicotine pouches, because that's what we're understanding people are gravitating towards. So yeah, we kind of match up what we have youth asking for with what we've heard youth are using.
Yep.
So we haven't done that lately. So no violations, no fines.
right. So do you have what you need then to do a
I do.
recap?
So what I would do with, oh, I'm sorry, you're going to vote. Go ahead. Sorry.
No,
Jumped ahead.
I don't think we need to vote. I mean, those are our opinions.
So if you just direct me, I can ask a TA, like Cheryl Sabara, who's appeared before you before, or Lisa, our new TA, who replaced DJ Wilson, whom some of you remember, who retired. One of them will draft your reg, you know, they'll take your regs and then insert the new language, new definitions, and any provisions that we just discussed here, updating the fines and so on.
Right.
And then we'll send that draft to you. The changes will be highlighted, and then you can, you know, we'll send them today. They will share them with you. Then probably at the next meeting, you have looked at them, and then you vote. And then when you vote, though, be sure and include an effective date.
Right.
Right. And then following on your reasoning, we do like the maybe 2 months, so it would be effective date of January 1, perhaps.
Right.
Okay.
Okay, yes.
Real quickly, can we make sure either Maureen or Day gets those in front of town council after you've drafted? I know there's a specific way that they've been doing these amendments, so to speak, or additions that to keep it consistent with the rest of our regulations.
Absolutely. Every amendment, every new regs has to go through town council before I present it to you.
Mhm.
Okay. Sounds good. We'll look forward to seeing those and voting on those at our next meeting.
Great. Do you want me to address the possibility of rejoining the regional
Yes,
tobacco
please.
program?
Yes, please.
So to give a little background, back in 2011, Melrose was awarded a tobacco grant. Turned out, you know, it turned out to be a 7-year grant. It was a 3-year grant with 4 possible 1-year renewals. And at that time, we weren't big enough to have our own collaborative like Boston does or Springfield or wherever. So we formed this collaborative with it was made up of 7 communities: Malden, Medford, Melrose, Wakefield, Winchester, Stoneham, and Reading. Then when that grant ended, a new RFR went out from the state, and we had to apply again. So we applied, but the new RFR had some very tough restrictions in it as far as our communities were concerned. 40% of communities had to be communities of need. And so that was based on, you know, this whatever chart that they had of, you know, lung cancer rates, income, education level, you know, socioeconomic values and so on. So anyway, 5 of our communities were not communities of need, 2 were, so that didn't, you know, we couldn't meet that 40%. So we had to figure out who was going to be in and who was going to be out. So Malden and Medford were in because they were communities of need. Melrose and Wakefield were in because it was a Melrose grant, and Melrose and Wakefield was a regional collaborative, so they were in. So we had to choose one other of the 3 communities, and Winchester was chosen because Winchester had more other public health things in common with us, or that we were working on together. a new food code thing, some of our emergency preparedness and so on. So the decision was made that we keep Winchester in, but we had to cut ties with Reading and Stoneham. And I think some of you may be aware that since then, since 2019, I have done some independent contract work for you so that we did an inspection of every store at least once a year, and we did a compliance check at least once a year. And frankly, most of your retailers don't even know that you're not in this collaborative. I go in and they say, oh, hi, how are you? And so it's worked really well, and you happen to have very, very, very good compliance. And usually when we stop doing compliance checks or something like that, compliance slips. That's why we do it. So anyway, I've been extremely happy and relieved that Stoneham and Reading have continued to employ me on the side so that we could at least be a face out there and see them and talk to them, and then, you know, share the new law with them, share the new signage with them, and so on. So really, you've kind of been on board, but you've been paying for it out of your own pocket. So the part of the 2019 law addressed the program budget, MTC's budget, and the legislators recognized that with a comprehensive new law like that, banning flavored products, requiring IDs, all this stuff that was new and different, nicotine content restrictions and so on, that the program would need more money. So they gave us more money in that first year for education. That was spent, many visits with retailers. And they gave us additional money that second year again. But now my collaborative is in great shape. Everybody's been educated. They have many, many visits and so on. But we still have additional funds. So MTCP came back to people like me who lost communities when that we had that new grant award in 2019, and said, if you want, talk to those communities that you had to let go and see if they want to come back in. And if they do, we'll give you the additional funding to be able to go, back into those communities. So that's on the table. If the board is interested, you can vote on that. And I already sent a day. It's a simple participation agreement, which is actually the same participation agreements that Malden, Medford, Melrose, Wakefield, and Winchester signed, that we submitted with the 2019 grant. And it just requires, 2 signatures, his and the board chairs. And then you have rejoined the collaborative. Then I'll be doing compliance checks and inspections with no, charge to you folks. It'll be covered by the state program. And then also things like tonight would be just part of my job, not, and I had offered to a day to come and do this anyway before I even knew about the extra money. I'm just doing this because you're our neighbor. Our kids know where Reading is, and we want you to have the same regulations we have, because we don't want Wakefield kids slipping over into Reading and buying products that they can't get in Wakefield. So anyway, this would just be automatically part of my job, that I would be available to you and meet with you and share information about, new things other communities are doing, or things that are happening on the federal level or whatever.
Great.
I mean, I don't see any downside, no?
Yeah, it's a no-brainer.
Yep.
It's
And,
an easy
and
one.
the formal name of this collaborative is the Regional Tobacco Prevention Collaborative. Is that the?
Correct.
Yeah. Okay.
It's we put Mystic Valley in front of it just so that we don't, if anybody needs to know geographic region kind of, but I almost never use that. I just say the Regional Tobacco Prevention Program.
Okay. Yes, Carrie.
And doesn't this program, so participation in this collaborative, this isn't the only thing that the 7 communities collaborate on. There have been other programs. And so being back into the fold is a plus in terms of programming for other things for the coalition. Is that right? Yeah.
Correct. In fact, we'll be at the Recovery Month vigil on the 28th in Reading Town Common with Erica McNamara and everybody else, because it is the Melrose, Malden, Wakefield, Winchester, that collaborative. You are correct.
Yep. Good. So
It lines you back up with us, yeah, but on the tobacco side.
So it helps our coalition folks. Excellent.
And we get to save money.
And we get to say, oh yeah, that was yes.
There you go.
So I make a motion that Reading rejoins the Regional Tobacco Prevention Collaborative.
Happy to second it.
Second, roll call, Carrie,
Yes.
Paula,
Yes.
Rick, yes. Okay.
Thank
Well,
you,
thank you
Maureen.
all so much.
Thank you,
Thank you,
Maureen.
Maureen.
Thanks, Maureen.
Forward to working with you more.
Yes.
We'll
Definitely.
look forward to it.
You're welcome to stay through the entire meeting, or you can leave. if you want.
I think she's got a glass of wine waiting for her.
Thank you all so much. Have a good night and good rest of your meeting.
Thank
Good night.
you.
Bye.
Bye-bye. All right. The next item on the agenda is the variance request for 1443 Main Street. Engineer Kavanagh is the environmental consultant and designer of the proposed sewage disposal system designed to serve the property located at 1443 Main Street. Last month, I witnessed the percolation test and the test hole observation. Based on the Title V regulations, where full compliance is not feasible, the approving authority is allowed to diverge from the goal of full compliance only to the extent necessary to achieve a feasible upgrade. Engineer Kavanagh is before you tonight to request a variance to conduct one test hole.
Oh, thank you, Dave. I'll pull up the drawing. Dave, can you see the drawing?
Yes.
Yes.
Okay. What we're proposing to do is replace a failed existing septic system at 1443 Main Street. This location-wise, this is obviously on Main Street, Route 28, going towards North Reading, on top of the hill, primarily adjacent to the gas station, if everyone's familiar with that. There is no sewer in any close proximity to the house. This actually is a second system I've designed on Main Street, on, I'll call it the hill. So what we're proposing to do is to replace the entire system. We have the existing tank, and there is a dry well right here. And we're going to propose to replace it with a new septic tank and a field. It's a tight site. The reason why we could only do one test pit, as long as the Board of Health and the engineer concur, we can do one test pit that is allowed per code. As you can see, really wasn't much room to dig with the dry well. We have the water service here. We have a sump pump pit, and obviously the septic tank, the driveway. So really, and we have trees, stone walls, and so forth. So we basically could only dig in one location to help determine how to design the system. And that's why we're in front of you tonight to ask for that one variance.
Dave, what is your thoughts on this?
My recommendation will be to approve the variance as proposed.
Okay. And you think that's sufficient in terms of the safety of the new system?
Absolutely.
Okay. It's interesting that the dry field, or whatever that's called, is right next to a water main under, it's pretty close, but I guess this has been here before and there hasn't been a problem.
So I think the
It looks-
setback needs to be 10 feet,
10 feet, yeah.
Okay.
and
Yep.
based on the, yeah, he meets the minimum
Yep.
setback
Yeah.
requirements. So
So it's like 10 feet.
So I thought I heard you say you had done dug the one hole already.
yes, we so prior to giving us the plan, I, as the soil evaluator, I have to witness a perk test and also witness the test hole, just to make sure that, you know, whatever he's proposing is actually feasible. And we did that already. Everything looks good. The plan he proposed, I've reviewed it. It looks good.
Okay.
He's requesting a variance, but I don't have the authority to approve a variance, and that's why he's before the board. And it's a really tight space.
Yeah.
And there's been a cesspool on the property, I believe, for decades, without issues.
Okay.
So I recommend that the board approve this variance request.
Okay, well, I'll make a motion that the board approves the variance request for one hole on this plan.
Second,
Second, roll call, Paula,
Yes.
Carrie,
yes.
Rick, yes. Thank you, Mr. Kavanaugh, appreciate it.
Thank you very much.
Thank
Have
you.
a good night.
You too.
I'll be in touch.
Thank you.
Thank you. All right.
Okay.
So the
We're
next
on a roll a day.
the next item on the list is 365 Ash Street. So as you all know, this property was condemned on July 20th. The Board of Health granted a 90-day extension to correct the violations listed in the condemnation order, as well as other violations that may prevent reoccupation of the dwelling unit. So far, no work has been done. Sometime in August, the owner checked out of the hotel and decided to leave in his car on the property. The condemnation order did not cover, the vehicle on the property. It only covers the dwelling itself. So he wasn't in violation of anything with regards to the condemnation order. So that prompted a meeting, and the hoarding task force, we met on August 25th, and we came up with an action plan to address the current situation. So we decided that the public safety clinician, Tonya, would do a weekly visit to assess the owner's well-being. We also decided that the police department would do a wellness check and property check, potentially every shift. The building department proposed the idea of portable toilets and a mobile home on the property. Mystic Valley Elder Services was at the meeting as well. They offered to provide meals on wheels, and also a cooler to help with food storage. And they also offered to help with wellness visits as well. So we had that going for about a week and a half, 2 weeks. And on September 6th, we did a wellness check, and it was determined that the owner needed to be transported to Winchester Hospital due to a raging infection. So currently he's at the hospital. The house is still condemned. There are no signs of activity on the property in terms of fixing the violations. And, it's just an update. And if I get any additional information, I would bring it to the board.
Paula?
Do I recall that the family was involved at one point
Correct.
and they are no longer involved?
They are still involved. Actually, the wellness check that was conducted on 9/6, it was due to the son calling because they couldn't reach their dad. And apparently he didn't have a way of charging his cell phone because he decided to live in the car. But yes, the children are still involved. And I just want to try to limit the information I give out.
Yep.
Kevin, did you have a question or?
Yeah, but now that Ade just mentioned that, probably not going to be something that he can answer or should. My question was around the other ongoing talks with family member and the property, specifically from a standpoint of what the owner would be willing to do with it. Trying to word this carefully.
Yes, the owner has inquired about selling the property on multiple occasions. And he has also stated that he would like to leave the property for his children. So there is no real plan so far, and the property is not getting fixed either. So
Yeah, I just, obviously just being in this market that we're in right now was the only reason I brought it up. It's, I wasn't sure if there was an attachment to the house for the owner other than leaving it for his kids.
Yeah.
it's a possibility.
Right.
We're dealing with a mental health issue.
That's what I was obviously assuming from seeing the pictures of the property. Okay.
Yeah, Carrie?
Yeah, I mean, I have a little bit of familiarity with some of these cases. It's can be time consuming and challenging for all of the parties. I'm really glad to hear that the task force was able to come together and devise what sounds like a really thorough care plan, while hopefully working and supporting whatever discussions there are on how this can be resolved.
Especially as winter approaches.
Is Ade, can I ask if council is involved?
At this point, town council?
No. If the family is engaged with any kinds of, never mind. It's okay. Never mind.
Ade, could you pass
I'm
along?
Yeah.
Could you just pass along to them that, I don't know if there's a hesitation. Sometimes people feel like overwhelmed and they feel like they need to clear out the property. The property actually has no value on the market. It's the land that does, and someone will buy that as is and let them walk away for good value as well too. Lots in Reading are going for excellent value, especially buildable lots. So just to pass it along to them, because I know that's sometimes a big, people feel really overwhelmed, and when they hear, oh, I don't have to do a thing. No, just leave, and they'll give you a check. That's all you got to do. It's really,
They are aware.
Okay.
And, the offsprings, the children would like that outcome, I believe, but the dad is a little bit hesitant.
Okay, and obviously for professional reasons, I myself am excluded from any transaction on that property as of the second.
Mhm. Yeah, Carrie.
I just want to clarify, just make it very clear that any of the questions that I'm asking about kind of status and so forth are in the interest of the well-being of the resident, and I'm not trying to pry or to make suggestions, but I'm very concerned about the well-being and safety, and I am glad that the town is taking a unified approach, and I hope that the family can find the support that they need as they work through this very complicated issue.
And I would commend the task force. That's a pretty robust plan.
Yeah.
To keep the residents safe, and work with the family. So that it's actually pretty impressive.
Hats off.
Okay, Marchon.
Hatchon. So we conducted an inspection at 34 Hatchon today around 2 p.m. Things appear to be moving in the right direction. We observed some fresh mulch on the ground. Some weed have been removed, some stones moved around. We also observed a pile of fresh mulch, fresh stones on the property. It appears that the cleanup activities and garden reorganization are still ongoing. We will continue to monitor the situation and report to the board accordingly.
Thank you.
Good to hear.
Thank you.
Kevin, any updates from the coalition?
Yeah, two quick ones. There was not actually a meeting on this past month. It was that our meeting date fell on Overdose Awareness Day. So instead, the coalition, town manager, superintendent of school, the police chief was there as well. And obviously Erica got in spoken. There was a more of a press conference down in the town common in regards to recognizing Overdose Awareness Day. So that was in place of our last meeting. And in continuation of that, obviously, Maureen touched on this earlier, coming up on the 28th this month, they are holding on the common their Recovery and Remembrance event. I mentioned this a couple times in this meeting, so I just want to reiterate, it's going to be on September 28th from 6 to 7:30 right on the town common. And you can go on their website, on the coalition's website, and to see those details. But they're going to have, it's not just like a press conference, it's more of an event. One sec here. And so there's going to be different points on the day. At 6 o'clock, from 6 to 6:15, it's kind of just like a networking event. And then from 6:15 to 6:45 that evening, they're going to have speakers. From 6:45 to 7, they're going to do a walk to remember and purple ribbon display. And then from 7 to 7:30, a candlelight vigil walk around the common. So that's going to consist of that night.
Just put it in my calendar.
Yeah.
Good to know. Okay, a day monthly report.
All right. In the month of August, the health department conducted 12 food inspections, 2 food re-inspections, and 3 food complaints. So we got a complaint from Bagel World regarding people grabbing the ice with a cup instead of using a scoop. We visited the location and we didn't observe any violations. We got a foodborne illness complaint from Reading House of Pizza. We conducted an investigation and it was unfounded. At Domino's Pizza, a guest overheard employees saying that the cold holding unit was at 56 degrees. So we visited them and apparently their cold holding unit was out of temp, and it got taken care of right away. We conducted 4 housing complaint inspections at 64 Prescott Road. That was due to an overgrowth on the property. We also got a call about Johnson Woods. The neighbors could hear through the walls. They could hear the other neighbors through the walls. That was unfounded. 99 Grove Street, trash piles in the neighbor's backyard, and 22 Gold Street, ventilation system in disrepair. So all those complaints were investigated and remedied. There was a septic abandonment at 47 Line Road. Pretty much, when a system fails or when a building or a dwelling is trying to tie into the town sewer, they are required to abandon their previous sewage disposal system. And that's when we usually get septic abandonments. There was a failed septic system at 15 Line Road. The sewage system was failing to protect public health, safety, and the environment. It was located 50 feet from a surface water. It was also located 50 feet from a bordering vegetated wetland, and it was located 100 feet of a surface water supply. So pretty much I filled the septic system and ordered the owners to upgrade or tie to town sewer. We conducted a population test at 1443 Main Street. That was the variance request. That was just before you. We conducted a test hole. There was a brand new septic system application at 1443. That's the same one we just talked about. I've reviewed the plan. It looks good. We were only waiting to get the variance request approved. It has been done tonight. So first thing Monday morning, I will be reaching out to Engineer Kavanaugh to let him know that his application is approved. We also got an inspection. We also got a complaint about cows on a property. We visited the site and there were no cows anywhere. We had 4 rat complaints, and we issued 3 temporary food event permits for Pizza World, Half and Half, and Scott Brothers Barbecue. And those were all at the Beer Garden Festival. Let's see, what else do we have? I am happy to announce that we offered the Public Health Admin Secretary position to Melissa Totten. She accepted the offer. Her start date is September 12th. That will be next Monday. And I will be introducing her to the board at the next meeting, at the October meeting. I don't typically have like a miscellaneous item section, but I decided to put it on this time around, just in case. The health department asked DPW to place signs at the 3 main entrances prohibiting dogs from swimming, drinking, and wading in town forest waters due to poor water quality. So because we're experiencing a drought, the water is starting to dry up and it's becoming more concentrated, and the water is starting to look really bad. Physically, you can see that this is not ideal for dogs to drink or swim or wade in. So those signs have been put out, and we also posted something on the social media website so that the dog owners will know that, if you allow your dogs to swim, wade, and drink in the town forest waters, it is at your own risk. And earlier today, we received a letter from Mary Ellen regarding the continued presence of rat bait boxes at Washington Park. She also mentioned the summer mosquito spraying program. We've not been able to investigate her complaints yet. We're thinking that maybe next week we'll get to it. In the meantime, we will investigate and report to the board accordingly. I will now defer to our public health nurse, Mallory, to provide update on disease surveillance, reporting, and control.
Hi. Okay, so as of today, there is 32 active cases of COVID. There is only 1 present active under the age of 5, no one between the age of 5 and 18, and the rest are 18 plus. I did have 1 case of Campylobacterius. He was resolved, not a food worker. He denied eating at any restaurants. He stated that he ate, he believes he ate fish way past the expiration date on accident and gave it to himself. I do have 1 potential case of salmonella that I'm investigating as of present. The new variant for the COVID vaccine is out, and it's going to be offered in the high school on the 16th and 30th, as well as a flu shot. And then we're holding flu clinics for Pleasant Street on the 21st, Cedar Garden on the 27th, and Frank Turner on the 29th.
Thank you, Mallory.
Thank you. You're muted, Carrie.
Sorry, I just have one question. So you have the bivalent vaccine and you'll be offering them both? Is that?
We don't currently have it, but we contract outside from Vaccinate. I think it's Vaccination RX, and she's coming 2 days, the 16th and 30th. And I think they're planning on having it once a month until they see less and less people.
Okay. And that 16th, those dates, that's open to the public?
Yep, open to the public. We'll have a calendar and post it on the social media.
And all ages?
I think it's like over the age of 5. Plus, I'm not too sure on the bivariant. I haven't read up to it, but yeah,
Over the age of 3.
18 plus 100%, but
Over the age of 3.
over the age of 3. Okay.
Okay, great. Thank you.
And that concludes the monthly report section.
Okay, any other questions or comments? We have one member of the public, 2 members of the public. If you want to make a comment, if you click on the reactions icon at the bottom and click on raise your hand, Jackie will provide you with audio.
Narcissa has her hand raised.
Okay, as does Emmy.
Emmy.
Okay. Okay. Who was first?
Narcissa was first.
Okay. Narcissa, do you want to?
Yeah, sure. Hello.
Hi. Hi.
2 questions. One of them, I thought we were going back to in-person meetings after August. What happened to that?
The state extended the state of emergency to allow public meetings to continue through March 15th of next year. And what we talked about at the last meeting was seeing how the COVID situation does through the end of this year before making a decision to go public.
Because it seems inconsistent with the rest of the town and other meetings that are taking place in person. That's why I was curious.
Yeah. What was your other question?
My other question is, given the fact that the CDC changed and you guys adhere to the CDC and everything they say, so in August they changed their criteria about vaccination and had a statement as far as the fact that the unvaccinated and vaccinated now have the same guidance, as well as no longer recommending to screen those without symptoms, students that can stay in class after being exposed. Just a few bullet points that I did not see on the site, which I would think should be there given everything else that you put there. So I was curious when that's going to be added.
Ade, do you want to comment on that?
Hi, Narcissa. Please send me any information. I will review the information. If we believe it should be on the website, we will post it on the website.
Okay.
Thank you very much.
Thank you, Narcissa. Emmy? Hello.
Hello. Hi, friends.
Hey, Emmy.
Mr. Chair, so formal. Can I have 5 minutes?
Yeah, sure. Well, let's do 3 minutes and see where we are.
Or a past chair, I think we should.
Okay, we'll make a variance
Yes.
in our 2 to 3 minute rule. Go ahead.
All right. So, Emmy Deb, Charles Street. So we're not, obviously I'm here to talk about COVID and the winter season. So, I think things have improved dramatically from where they were a couple years ago, but we're not yet quite at mission accomplished. So, so far this year, we've had in the state of Massachusetts 5,000 deaths, which if we overlay that on pre-pandemic numbers, that would make it the third leading cause of death by a substantial amount. And I think by the end of this year, we'll probably be at around 4 times the number of deaths you get from flu and pneumonia combined. Additionally, if we look at the June through August time period this year and compare it to that same time period last year, we've actually seen an 85% increase in deaths statewide. And this is likely due to a combination of, people maybe not being up to date on their vaccinations, but mostly probably behavioral changes. So as we prepare for the winter, obviously we want to push vaccines, which it sounds like we're doing in the town, which is great. And then we want to talk about the thing that nobody wants to talk about, which is mask policy. So last spring, you reviewed mask policies in surrounding communities and suggested you may have been a little late to require universal masking, which I agree with. But in fairness, you were acting on the fly with limited guidance and a changing landscape regarding metrics due to changes in testing, vaccination levels, and the dominant circulating variant being Omicron. So last spring, I sent you a list of potential metrics and thresholds, which I think you were understandably hesitant to use. And then in late February, the CDC established the community level metric for determining COVID response and updated recently their guidance in August. That guidance has been met with criticism from many public health scientists on 2 main points. The first being isolation ending at day 6 without requiring a negative test. We now know people often continue to test positive for up to 2 weeks. And although the CDC requires masks for days 6 through 10, that's not always feasible in every setting. So for example, in schools, students will be in classroom masks, which is great, but then they'll be in school at lunches unmasked with their peers, which is a substantial loophole that the virus has taken advantage of. And then the second point would be that community level metric relies on hospitalizations, which we all know is a lagging indicator. There's not a whole lot they can do about that. But I think the CDC is really trying to, number 1, maintain access to education, healthcare, and employment, and number 2, account for changing disease severity. And both of those things are good. When I look at their metric and I compare it over since February, with my own metrics, they're actually in alignment, which is great. So I'm actually pretty happy with the CDC guidance. We all know masks are effective, as has been observed in your own analysis, as well as in a new preprint looking at spring mask policies in the greater Boston area schools and associated absences and community cases. So all of this is to say, I encourage you to use the CDC guidance on community levels as a trigger for universal masking. And I hope that you'll consider discussing this at a future meeting. And to put this into perspective, this would amount to a maximum of 6 weeks out of the last 29 weeks. That was the only time that we were at that high community level. And presumably if people were actually wearing masks, it might be shorter than that. And one last thing is just I think it's important to recognize that even with masks, the holidays are tough, and it's not going to eliminate disease. It's not going to eliminate a wave, but it will help and it will save lives. And I hope that vaccine uptake will be sufficient to minimize the need. So everybody go out and get your boosters, your new bivalent boosters. Go to the high school.
Yes.
Thank you.
What was the time on that? That was pretty.
Yeah.
No, I was trying to do it real fast.
Yes, Paula.
So I thank you, Emmy, for all of that. You did a great job. My concern about this at this point in the game is people are not testing, and people are going to events unmasked with symptoms, and we don't have control over it. We don't know how many people are actually infected.
Right. And that's why I think that the CDC is largely relying on that hospitalization number, right?
Yeah.
Because that gives you some idea of the level of disease. It's the more important number, right? I mean, it's not so much that we're worried about to some extent disease, but we're really worried more about disability and death, right? It would be great if we could get rid of disease as well, obviously.
Right.
But we take what we can get.
Right.
Well, we'll certainly take all of that under consideration, and we should probably bring it up at a future meeting this fall in anticipation of, the winter and what might happen.
Maybe even the next meeting?
I'd like
October.
to see that in the October meeting, yeah,
Sure.
if we can. I don't know what else is on our agenda, but I think that this is a important topic to address early. you
Yeah.
know.
Yep. Okay, sounds good. Thank you, Emmy. Appreciate
Thanks,
it.
Emmy.
Thank you, Emmy.
Yeah, I mean,
Okay, which kind of leads us right into the next meeting agenda. So we'll need to think about talking about how we approach the winter with respect to COVID and the current CDC recommendations. There are a couple other things. One is that I think ADAE has already drafted an RFP for community needs assessment. And one thing we could do would be to have him send it to us in advance as part of the board packet, and then have us have a discussion about the RFP and sort of next steps on that. And then depending on how the agenda goes, whether it's October or November, I would ask ADAE to give us a 6-month update on the recommendations of the MAPC. We received their report in March or April, and it would just be, I think it's important for the board, at least for the next year or two, to kind of track where we are. I think we are making progress on a lot of fronts. It would be nice to document that and for all of us to understand where we are. And then we have the tobacco regs, which we will have to vote on. And I think, so other than that, there's really not a whole lot going on. But those are things that sort of we've been thinking about going forward. The only other thing I would mention is I saw on the select board, they're going to be reviewing the warrants that are going to the town meeting, and Article 11 is the request for the town meeting to approve for the select board to propose to the legislature to increase our membership to 5 full members. So that's sort of on.
Do we need to get out there with signs? Supporting it.
I mean, Carrie, aren't you a town meeting unit?
I am a town meeting member.
Okay,
Here we go. Here we go.
Always Kevin.
We have a
Okay, so we have our advocates in place.
Kevin.
Yep, Kevin and I.
Oh, Kevin as well. Okay.
Yes.
Okay,
Yep.
great.
Yep, I'll be there.
Yes.
Speaking of warrants, sorry, I just want to, if I remember right, we were talking about the health assessment, and I was asking about budget, and that's part of the warrant as well, correct?
So I met with Fidel, town manager, and we decided not to go that route.
Okay.
Because of the other things on the list for town meeting. So we decided that we would use ARPA funding instead of asking for the money at town meeting.
Great.
What kind of funding?
ARPA.
The
ARPA?
ARPA.
The ARPA. Sorry.
Yeah.
Sorry.
I think that's a great use. That's great.
Perfect.
Yeah, that's definite community benefit. So, okay, good. So we don't have to
Go
beg.
to town meeting for
Okay, good. Great. Congratulations. Thanks for securing that funding. Thank you, Dell, and the ARPA folks.
Yay.
Anything else? I think we're good. Motion to adjourn? Do I have a second?
Sure do.
Okay, Paula. Roll call, Terry,
Yes.
Paula,
Yes.
Rick, yes. All right, well, we'll see you
Everybody.
next month.
Good night,
Bye.
everybody.
Right.
Thank
Good
you.
night.
Have a good
Thank you.
weekend.
Bye.
Bye-bye.
Bye-bye.
Thanks, everyone.
Thank you.